Well, one thing does not preclude the other, although the goals are totally different. For the severe heart failure patients, it's about treating symptoms on top of modifying the need for hospitalizations and even mortality. For the mildly sick patients, and again, just like John said, what we're focusing on here is mainly patients who have had some heart failure event in the near past. For those patients, it's about disease progression. And from what the studies tell is that the magnitude of improvement is even greater in mildly ill patients than it is in the severe patients. So the gain from society point of view is potentially greater in mild heart failure patients than in the severe heart failure patients.
I think Celia's put that very nicely. We have a spectrum of needs from these patients, with the very severe patient needing hopefully both an improvement in symptoms and outcome, but perhaps symptoms is the most pressing need, whereas in the patients with mild heart failure, it's predominantly a prognostic therapy that you're looking for. When we analysed the data from CARE-HF, we had, and this is a question I'll ask Celia, whether they measured some biomarkers in the reverse study. I haven't seen any biomarker data, for instance NT-proBNP. Now, these natriuretic peptides, and particularly NT-proBNP, are extremely powerful prognostic markers and allow us to separate our patients out into patients in different risk groups. And when we do that within CARE-HF, it's quite interesting. The sickest patients had obviously a much higher control group mortality. The benefit in terms of reducing mortality was about a 35% reduction. Statistically significant and obviously a very powerful effect. But if we look at the milder patients, the patients in the lower BNP groups, it's a 52% reduction in mortality. And in fact, when you look at relative risk, it looks as though it's going the same way in reverse, that we might be seeing 50–60% reduction in mortality in these milder patients. So it may well be that the prognostic gain is greater in the milder patients, the symptom gain is greater in the sickest patients. And to some extent, the treatment is tailoring itself to the patient's needs.